Welcome to the Health and Lifestyle Hour at ETV. I'm Dr. Hilary Aheisibwe. I'm an obstetrician and a gynecologist. I work with Neocare Clinic and Fertility Centre-Mbarara. Today, I'm going to talk about a very common condition, a condition that has caused a number of our women, our people to live miserable lives, to have challenges in their day-to-day activities. And this condition is filled with a lot of myths, a lot of untruths, and of course, a lot of truths, especially in as far as the information in the public domain is concerned. And this is the topic on fibroids. Now, talking about fibroids, they are very common, but unfortunately, they are neglected. There are not so many people talking about fibroids. Even those who do so by perpetrating a lot of misinformation, as usually seen on a number of news sources. And today I come to dispel the myths, but also to restore hope for those who are having these fibroids. The latest studies in our region here in Mbarara and southwestern Uganda, a study by Adawe et al. In 2018-2019 actually found that we had about 28.2% of women who were attending the gynecology clinic at Mbarara Hospital were suffering from fibroids. Honestly, if for every 100 women coming to the clinic, and this is the clinic at Mbarara Regional Referral Hospital for gynecology, if 28 for every 100 had fibroids, this is a very high burden, and this means they deserve the attention that is needed. So what are fibroids? Fibroids are abnormal growths, usually non-cancerous growths. We may use the word benign growths in the uterus, and usually they will occur among women of reproductive age. Usually there are a number of risk factors and causes, as we are going to see, but before I proceed, I will share a few of the signs and symptoms of fibroids. How can one know or suspect that they have fibroids? Women who usually feel that pressure in the pelvis, heaviness, sometimes pain in the lower abdomen, those could be what one will first experience as signs and symptoms of fibroids. A number of women will get menstruation abnormalities, either an increase in the quantity of blood loss during their periods, but also the duration for a number of women, the duration of bleeding, the duration of the menses may become a little bit longer. Instead of 3 to 4 days, someone goes into their periods for a week or even more, and some get to a level where they even get anemic. A number of women with fibroids will have painful periods, something that we call dysmenorrhea. It's quite common, and of course partly due to the pressure effects exerted by these fibroids. When the fibroids are big and maybe are pressing on the bladder, some women usually present late with difficulty or challenges in passing urine, sometimes in retaining urine, and unfortunately others also for big fibroids, they may present with constipation or difficulties in passing stool. Still again, because of the pressure effects of the fibroids on the neighboring structures. Anteriorly or in front of the uterus, we have the urinary bladder, but posteriorly we have the rectum. So for big fibroids, if they press on these organs that I've talked about, then one is going to have challenges with the functionality of those organs. So there are we don't know exactly what causes fibroids, but science suggests that yes, there are genetic predispositions. For people who come from families where first or second degree relatives have had fibroids, there is an increased chance that these people will get fibroids. We also know that fibroids are more common among blacks, the black race, compared to the white race. There are current researches that suggest that there is a role of vitamin D in the growth of fibroids, but of course we are continuing to study along those lines. There is also a common belief, of course, that yes, since we know that the hormones responsible for the growth of fibroids, the estrogen and progesterone, are more active, if I may use that word, during one's reproductive age, for those women who will delay or who delay to conceive, or who delay, who have a long interpregnancy interval, they may also get challenges with fibroids. Now, fibroids are also common among women who have infertility. If, for example, infertility is due to blockage of the tubes or tubal blockage, one will develop fibroids. But also sometimes fibroids can also be a cause of infertility. One, by causing blockage of the tubes, but also the same fibroids can make it difficult for one to conceive, for a pregnancy to implant onto the uterus. For those who are lucky sometimes and they conceive, these fibroids still can increase the risks for pregnancy losses or for miscarriages. So by and large, these are conditions that we must pay attention to, that we must, as clinicians, treat, tell our people about, but also the population to be alert, to be concerned, and to have knowledge concerning these fibroids. There are a number of investigations that can be done, but we are very lucky that currently the accessibility to the ultrasound scan, I can say, is almost universal. Leave alone what you go talk to the doctor, they examine you, because during abdominal palpation, we are able to identify and say, yes, you have some masses in the abdomen, in the uterus, and from what we think, this could be fibroids. Now, even before we get to that, now we are able to have scans. They are readily available. Our ordinary obstetric and gynecology scans are able to identify fibroids. Of course, though not absolutely necessary, we have even higher investigations, the CT, the MRI, that can be put to use in as far as making a diagnosis of fibroids is concerned. Now, as I go to the treatment options available, I want to emphasize that there is a lot of trash on media. People parading a lot of things, claiming that they will use herbs. We don't have any authorized herbs in this country that can be used in the treatment of fibroids. We don't have any herbs that have been studied and proven to treat fibroids in Uganda at the moment. So I encourage all people that if you have these challenges, share with a qualified health care provider, preferably a gynecologist, and they take you through what can be done. So we have looked at how we can make a diagnosis, how we can get to know that someone has fibroids, and therefore to alleviate their problem. What do we do? How are we going to treat these women? So treatment is individualized. We can discuss, depending the circumstances available, and the circumstances, if the fibroids are symptomatic or not, the age of the patient, a number of factors can be put into consideration to determine how we are going to treat these women. Of course, the most common treatment modality is surgery. We do a procedure called myomectomy. Myomectomy is a very, very safe procedure done in theater and removes fibroids, with the surgeon having very, very good control of the operation field and the steps of what they are carrying out. So we shall get out the fibroids, show them to the patient, repair the uterus. If they have fertility desires, after they have healed, we encourage them, you go and get pregnant. We have a number of people who may not want a big scar on their tummies. Science now has gone to another level. We are able to use the laparoscopy or pinhole surgery, where again, through a small hole on the abdomen, on the tummy, we get to look at the uterus, identify where the fibroids are, and remove them using a number of techniques as required, depending again on the sizes of these fibroids. We have other procedures like uterine artery embolization. Of course, we have macellation procedures that we have which can be done under laparoscopy. But we also have cases, especially for older women who maybe have already completed their family in their 50s, to reduce any risks that may result along the reproductive system. We may agree with them and do what you call a hysterectomy if someone has already had their full family and they have no fertility desires. Now, there are medical approaches that don't require surgery. We currently have a number of drugs that work at the level of the brain. At the level of the brain, we have a hormone called the gonadotropin releasing hormone. We're able to use both its antagonists and agonists to actually reduce the size of fibroids and sometimes to shrink these fibroids without necessarily performing surgery. So what happens in this case is, yes, we prefer someone again who is not planning to conceive so soon, and then we reduce the size of the fibroids, either with an aim of later going in to remove them after getting shrunk, but also in most cases to get them to relieve the symptoms and improve the quality of life in these patients. So the take-home information today is, one, fibroids are very common. They have come, they are with us, and the prevalence is even going higher because of a number of factors. But also to assure the viewer and the listener out there that the treatments are available. We have the qualified personnel, people who are committed to make sure they attend to our patients with fibroids, but also we know they have dangers with one's quality of life, and therefore treatment is available. And we encourage everyone, if you ever get someone with fibroids, please get to the nearest health unit, identify someone well qualified to handle them and seek treatment. Thank you.